Hello everyone. First of all, I want to thank everyone for your response towards the channel, which is so remarkable that it is really helping me a lot to grow the channel. And for that, I'm really grateful to all of you, young doctors and staff nurses and all the students. Thank you so much once more. In this video, we will talk about one of the four methods for calculation of the heart rate using the ECG paper. Why it is important? Because we want to know whether the patient is having normal heart rate, which is around 60 to 90 or 60 to 100 beats per minute, or if the patient is having tachycardia, which is when the heart rate is more than either 90 or in some books it's the 100 beats per minute, and that becomes very important clinically. Or if the patient's heart rate is less than 60, which we call the bradycardia. So there are four ways, and in this short clip we will talk about the first method, because I want to make short clips so that you guys can understand it properly. And at the end of the video, if you think the video is good and is benefit to some of you, then please like the video, share the video, and also I request you guys to subscribe the channel and press the bell icon, because this is the only way to improve and grow this channel. In the first method to calculate the heart rate, there are certain points or steps which we are to carry out. For example, first of all, we are to memorize it. We are to cram these set of the digits. No matter what, you are to memorize it. 300, 150, 100, 75, 60, 50, 43, 37. Just keep on repeating it as many times as you can, because you are to memorize it, because method 1 is the only offhand way and easiest way of calculating the heart rate using the ECG paper. So always memorize 300, 150, 100, 75, 60, 50, 43 and 37. First step is this. Second is to know that whenever you hold a ECG paper in your hand, you will notice that there are certain fine or thin lines and there are certain thick lines like these red lines. Now these thick lines, they separate two large boxes from each other, and these fine or thin lines, they separate the small boxes. These are the small boxes, these are the thin lines, these are the thick lines which separate two large boxes. So first thing was to memorize this set of the digits, second was to know this fact, and third, whenever you see a tracing of the ECG, it will comprise of the P wave, QRS complex, and R wave is the tallest wave in most of the ECG leads. If there is no R wave, it will be the S wave, like for example in case of the V1 and V2. So here we are taking the example of the tallest deflection, positive deflection, which is R wave, but where you don't find the R wave, you can take the help of the deep S wave. So these are three very basic important things to remember. Let's take an example here. Now this is a ECG strip, and this strip has got these red lines, which are the thick lines which separate the large boxes from each other, and the green are the thin lines which separate the small boxes, which are not important in our discussion here. Now here we see that this is a QRS complex or ECG tracing which is present right on the paper. Now first of all, on all of the ECG paper, we are to locate one specific R wave which is falling right on top of any of the thick lines. So that will be our reference R wave. This R wave is falling right on top of a heavy or thick lines. Now once we have selected the reference R wave, then we are to look an other next R wave next to the on the right side of this reference R wave. This second R wave does not need to be on the top of the thick lines. Now this is for ease of our understanding that the reference R we are trying to locate on very top or parallel to the thick lines. The second one does not need to be. So once we have located the reference R wave, on its heavy lines we do not drop the formula, but on the every other thick line which is in between these two R waves, we drop this very formula which we have crammed or memorized a lot. 300, 150, 100, 75, 60, 50, 43, 37. For example, on the first heavy line, after the thick line on which the R was located, we drop 300, then 150, then 100, then 75. And here notice that this R wave, which is next on the right side of the reference R wave, is located somewhere between the 75 and 60. So the heart rate is around roughly 70 or 72. We are not to be exact about it. Why? Because we want to know whether the patient is having a normal heart rate, a bradycardia or tachycardia. So here the heart rate is around 72. This is the easiest and most offhand way of knowing the heart rate. Now this is another example where we see that this is an ECG paper, and here are tracing of the QRS complexes on the ECG paper. And if you just concentrate that the reference R wave, this is the reference R wave, because this R wave is located right on top of or parallel to the thick line, or it coincides on the thick line. So we select it as a reference R wave, and next to it, on the right side next to it, be it on the thick line or not, it doesn't matter. So you are to now drop this formula of 300, 150, 100, 75, 60, 50, 43, 37, 300, 150, 100, 75, 60, 50, 43, 37, 300, 150, 100, 75, 60, 50, 43, 37. So that shows the importance of memorizing it, cramming it. So here we drop it 300, then it is the 150, but see it's located just beyond 150 but well below 300. So this is somewhere around 160. So this is indeed a tachycardia. So using method 1 is the easiest way, most offhand way, because all of the three require you to calculate it and they, or use the calculator. So better to follow the method number 1. So there is not everything okay with the method number 1. There is certain limitations of the method number 1. For example, it requires or we assume that R to R interval is regular. Every two R waves have got a regularity amongst them. But in case of the atrial fibrillation, R to R interval is irregular. And in case of the complete heart block, we also fail to use this method, because in those cases mostly the heart rate is like around 20, 25, 35, and our formula goes no less than like 35. So these are two main limitations to the method number 1.